Welcome student, I am Mr. Abhijit Bambre, working as Assistant Professor at Gokhale Education Society's Arts, Commerce and Science College, Jawhar. In last video, we discussed anti-diabetic agent. In that, we discussed what is diabetes. It is a chronic metabolic disease, then causes of diabetes, what is diabetes mellitus, and pancreatic cell, that is alpha cell, beta cell and D cell, which produce different compound that perform different function, which produce insulin, and a deficiency of insulin and resistance of insulin cause a diabetes. Let's move. Diabetes mellitus. Diabetes mellitus is a chronic metabolic disease caused by a variable combination of two pathogenic factors, that is insulin deficiency and insulin resistance. Then diabetes mellitus means, as we know, Greek word diabetes, it came from Greek word, that is it means to pass through, and mellitus, it's an Latin word, means a sweet. Then we discuss different three type of pancreatic cell. Alpha cell produce glucagon, which promote conversion of glycogen into glucose. Glucose is required to fulfill energy need of body. Then beta cell and D cell, these three cell function in coordination to maintain the level of sugar in the blood, that is the normal level is 60 to 90 mg per 100 ml, right? Or insufficient synthesis of insulin in pancreas cause or reduce metabolism of glucose. As a consequence, sugar level is increased to high level, could not be bring down to a normal level, and the condition is called as hyperglycemia. It's all about last lecture. Today we are going to start type of diabetes mellitus. What is type? There are four main type of diabetes. Type first, it was formerly called as juvenile onset diabetes. Type first is called as juvenile onset diabetes. In this type, hyperglycemia, glucosouria, polyuria, polydipsia develop rapidly. Those are symptoms of diabetes mellitus. Polydipsia means increase in thirst. Polyuria means urine output is increased. Glucosouria means the blood glucose level is exceed. It is that are symptom of diabetes develop rapidly in this type of diabetes. This kind of diabetes are dependent on external insulin administration. This in type first diabetes, patient need external insulin. Type second, this type of diabetes was formerly called as maturity onset diabetes. People over the age of 40 year are prone of this type of diabetes. After 40 year, generally it is called as maturity onset diabetes. Obesity is an important contributory factor in this type of diabetes, means second type of diabetes. The diabetes of this type are able to synthesize insulin in this type, but not in adequate level that is required to maintain an use of oral anti-diabetic drug if required. Can control this type of diabetes In second type of diabetes, age of after 40 age, this type of diabetes is seen. uh, in generally, insulin is synthesized in body of that individual, but it is insufficient or it is an adequate level. So external insulin is required. Next, type third, several indirect factors such as insulin receptor abnormalities, some pancreatic diseases, hormonal imbalances, excessive use of potent and toxic drug may cause this type of diabetes. In third type of diabetes, it is caused by a external factor, means insulin receptor abnormalities, pancreatic diseases, some hormonal imbalances, then excessive use of potent and toxic drug may cause third type of diabetes. In fourth type, factors such as acute mental tension and stressful life may cause the symptom of diabetes that appears suddenly. Is due to a mental tension, stressful life. It can be treated simply by maintaining dietary activities. Fourth type of diabetes is treated by maintaining dietary plan given by the doctor or dietary activities and short-term insulin supplement if necessary. It is not necessary. If necessary, for a some person insulin is given, but four type of diabetes is maintained or treated by a dietary plan. There are four type of diabetes: type first, type second, type third, and type fourth. In type first is called as juvenile onset diabetes, type second is maturity onset diabetes, type third was caused due to some another factors such as insulin receptor abnormalities, then pancreatic diseases, then hormonal imbalance and excessive use of some toxic and potent drug. And last one was type fourth is due to acute mental tension, then stressful life, and may cause the symptom of diabetes appear suddenly. It can be treated. Fourth type of diabetes is treated by a maintaining dietary plan given by the doctor. Next, insulin therapy is an therapy for a diabetes patient. It is one type of therapy for a diabetes patient. Insulin is a type of hormone consists of two polypeptide chain having 21 and 30 alpha amino acid which are held together by disulfide linkage. Insulin therapy, insulin is an hormone. Got it? It consists of two polypeptide chain having 21 and 30 alpha amino acid which are held together by disulfide linkage. Insulin is mainly extracted from bovine insulin and pork and then purified by a crystallization. Mainly insulin is obtained from beef. Third one, human insulin is nowadays produced by a recombinant DNA synthesis. Nowadays, a human insulin is produced by recombinant DNA synthesis, in which human genes for insulin are inserted into E. coli to produce recombinant insulin. Example: Lispro, aspart insulin, etc. is an human insulin produced by a recombinant DNA technology. Next, insulin is used to control hyperglycemia in diabetes mellitus and it is called hyperglycemic agent. Insulin is also called as hyperglycemic agent. Insulin does has to be given by injection through subcutaneous route. We studied route of drug administration. There is various route of drug administration: oral route, then intravenous route, subcutaneous route. Here insulin is given by injection through a subcutaneous route. Got it? It cannot be given by oral route as it is protein. Insulin cannot be given by oral route because it given by subcutaneous route, because it is an insulin, it is an protein, and hence get digested by enzyme in gastrointestinal tract. Is an insulin therapy for a diabetic patient. Insulin is an hormone. It is insulin is necessary for a metabolism. It consists of two polypeptide chains having 21 and 30 alpha amino acid held together by disulfide bond. Mainly it extracted from beef. Nowadays insulin is produced by a recombinant DNA technology. It also called as hyperglycemic agent. It given through the by injection through subcutaneous route. It cannot be given by the oral route because it is protein, and hence get it digested by the enzyme in the present in gastrointestinal tract. Next, insulin is injected directly into this systemic circulation, and hence it is a more effective than other oral hypoglycemic agent because onset time is increases. Insulin is prepared in 3 doses form for use in insulin therapy: type, time for onset of action, duration of action, and dosage form. There is 3 dose form for use in insulin therapy depend upon the individual or patient. First type, rapid acting. Second, intermediate acting. And third, long acting. Time for onset for a rapid acting dose is more than 1 hour. Duration of action for a rapid acting is 5 to 7 hours. And dosage form is insulin zinc suspension, in the form of insulin zinc suspension. Second, intermediate acting. Onset time for onset of action is 1 to 4 hours. And duration of action means how long it act, it is 18 to 24 hour. And dose suspension given as globulin zinc insulin suspension, whereas long acting dose, it time for onset of action, it react 4 to 6 hour. It time taken to react is 4 to 6 hour. Duration of action means how long, it is 24 to 36 hour. And suspension given is proteamine zinc insulin suspension. There are 3 doses form for a use in insulin therapy. Next, there is so many drawback of insulin therapy. The success of that we discuss one by one. The success of insulin therapy depend on the purity of insulin, right? Then sterile state of syringe and the way the injection is given is important for insulin therapy. Here there is a need of sterilization, right? Then the treatment with insulin may cause cardiovascular and renal problem. Treatment of insulin, the main drawback of insulin therapy was the insulin may cause cardiovascular and renal problem. The improper method of insulin administration may affect vision, which may lead to cataract and even blindness. Is also main drawback of insulin therapy. It create a blindness, it affect the eye, or it affect the vision. The drug injection of insulin, which is protein, may cause allergic and hypersensitivity reaction in some patient. It vary person to person. Actually, it means some patient it cause allergic and hypersensitivity reaction. Small being tumor may develop at the site of injection, which slow down the absorption of insulin. Is also drawback of insulin therapy. It's all about drawback of an insulin therapy. Thank you.